Today's headline is about a group of Zimbabwean nurses who have launched a clinic specifically to treat illegal foreigners only. Their message is clear: they say they will not stand by and watch people die because of their immigration status. It's a bold and emotional move that stirred both compassion and controversy across South Africa. Hello, welcome back to the channel. This is a video and picture news about the Zimbabwean nurses who have opened a clinic dedicated to providing medical care for undocumented foreign nationals. Be sure to watch till the end to see the sources and verify this news for yourself. The clinic, which was quietly set up on the outskirts of Johannesburg, has become the center of attention after reports spread that its services are meant only for foreigners living in South Africa without proper documentation. The nurses behind the initiative say they were driven by the growing number of foreign nationals being turned away from public health facilities due to overcrowding, lack of papers, or fear of arrest. One of the founders, a Zimbabwean nurse who asked not to be named, told local media that the clinic was born out of desperation. She said they had witnessed too many people suffering in silence because they were too scared to seek medical help. She explained that they could no longer ignore the suffering, especially when women were giving birth in unsafe conditions and sick children were left untreated. According to reports, the clinic operates on donations from well-wishers and volunteer healthcare workers, most of whom are also foreign nationals living in South Africa. The clinic provides basic health care, maternal services, and treatment for chronic illnesses. However, it's not registered with the Department of Health, raising questions about legality and safety. While some people have praised the nurses for their compassion and commitment to saving lives, others have criticized the initiative, saying it promotes lawlessness and encourages undocumented migration. Critics argue that healthcare should remain regulated to ensure safety standards are met, and that creating clinics exclusively for foreigners could deepen divisions between locals and migrants. Local residents have mixed feelings. Some say they understand the nurses' intentions but worry that the operation might be illegal and unsafe. Others argue that the government has failed both South Africans and foreign nationals by not providing enough resources to serve everyone fairly. One resident reportedly said, "We all want people to get help, but how can this work if the clinic itself isn't recognized by the law?" Officials from the Gauteng Department of Health have not yet confirmed whether they will investigate the facility. However, the department maintains that all medical centers must be licensed and follow strict health protocols. Operating outside those guidelines can put patients at serious risk, no matter how good the intentions are. Human rights activists have defended the nurses, saying their actions highlight a growing humanitarian crisis. They argue that many foreign nationals, particularly from Zimbabwe, Malawi, and Mozambique, face huge barriers to accessing healthcare in South Africa. These barriers include documentation issues, discrimination, and fear of deportation. According to them, the new clinic exposes how dire the situation has become, where nurses feel compelled to act independently to save lives. In recent years, there have been several reports of foreign nationals being denied access to clinics or hospitals, especially in overcrowded townships. Some healthcare workers have admitted that the pressure on the public system is intense, but they also insist that no one should ever be turned away in an emergency. The nurses behind this new clinic say they are simply filling a gap that the system has ignored for too long. Community leaders are calling for calm and understanding, urging the public not to see this as an act of defiance but as a cry for help. They say the issue reflects the wider challenges in South Africa's healthcare system, where there's not enough staff, medicine, or equipment to meet the needs of millions of people. Meanwhile, social media has exploded with debate. Some South Africans have praised the nurses for showing humanity where bureaucracy has failed. Others argue that the move undermines the country's health regulations and may create even more tension between locals and foreign nationals. The topic has trended online with mixed emotions, some seeing the nurses as heroes, others calling them reckless. Medical professionals have also weighed in, warning that while the nurses' compassion is commendable, operating without proper certification could have dangerous consequences. Without official oversight, there's no guarantee that the right medicines, hygiene standards, or patient records are maintained. But the nurses insist that they follow proper care standards and are guided by the ethics of saving lives first and foremost. A few anonymous sources claim the clinic has already helped over 100 patients in its first few weeks of operation. Most of them reportedly came seeking help for conditions like high blood pressure, pregnancy-related complications, and infections. The nurses say they don't charge fixed fees but accept small donations from those who can afford it. The story has reignited an emotional national discussion about access to healthcare, immigration, and humanity. Some people argue that in a country still healing from deep inequality, compassion should always come first. Others believe rules are necessary to prevent chaos and protect public safety. Both sides have valid points, but what's clear is that this incident has forced people to confront uncomfortable truths about South Africa's healthcare system. Health experts say this is not the first time such private initiatives have appeared. In areas where public clinics are overwhelmed or hard to reach, small informal health centers have popped up to fill the gap. While some are run responsibly, others are not properly equipped and can pose risks to patients. Authorities are therefore faced with a difficult balancing act, allowing humanitarian work to continue without compromising safety and law. A spokesperson for a local health NGO said the government needs to address the root causes rather than chasing after people trying to help. They suggested that South Africa should look into creating special permits for foreign healthcare workers who want to volunteer legally in underserved communities. That way, compassion can operate within the law instead of outside it. At the end of the day, this story is both inspiring and troubling. It shows how deep the cracks have become in the public healthcare system and how desperate some people are to find a solution. Whether the clinic will be shut down or supported remains to be seen, but one thing is certain, it has sparked an important conversation about dignity, access, and empathy. Before we close, one local joked that these nurses have done what government couldn't, open a clinic without waiting for 5 years of paperwork. Maybe they should be teaching the Department of Health a thing or two about. If you're new to the channel, please don't forget to subscribe for more verified South African news updates. And remember to always watch till the end to see the sources and verify everything for yourself. All images used are for illustration purposes only. Sources: SABC News, News 24, Gauteng Department of Health, Times Live, and Daily Maverick.